Awesome. Welcome, everybody. Thank you to today's episode, Talking Shit. This time we're talking shit with Dr. Adriana. She, near and dear to my heart, I met her in a program where we were both learning the biology of trauma. So we're like to geek out on that sort of stuff. I'm Heather Gray with Discovering Health. I'm a functional diagnostic nutrition practitioner. I know it's a mouthful. And I work with fast-paced, on-the-go professionals who want to get out of brain fog, who want to get out of their depression, out of their anxiety, out of their chronic pain and autoimmune issues without the use of drugs and surgery, right? Through functional lab work, I get to the root causes of people's malfunctions. And then the next couple of months, we coach you up and get those basics of lifestyle. So that way you have longevity and health for the rest of your life, not just a quick fix. The reason this is called Talking Shit is because it's a tongue-in-cheek kind of twofold. So the first part is a lot of times I will have other practitioners on, and sometimes we'll talk about coffee enemas and parasites and, you know, what does the perfect poo look like? The other part of the Talking Shit is literally talking about the subjects that aren't being talked about enough, right? Because people aren't healing when we keep stuff in the dark. So we bring that shit out of the dark into the light where we can heal it. And today, my guest, big background in addictions, anxiety, depression, mental health, all my favorite topics. So I'm super, super excited to dive deeper and talk some shit with Dr. Adriana.
Thanks, Heather. Thanks for having me here today. Yes, we might not be talking about the perfectly shaped poo, but we might be talking about this shit that is keeping people from having happiness, from having peace, from having more ease in their life. People are really struggling, especially right now, this last couple of years in this pandemic, and people are at war now, and just all these crazy things that are going on in the world. It's really taken its toll. I'm sure you've seen it too in the clients that are coming to see us. More people are complaining of mental health issues than ever before. It's hard to even get in with a therapist right now. We're all just so kind of overloaded with the need and the demand for support around these issues.
Yeah, it's heartbreaking. And what it's done to our teenagers and our kids, like that's the part that I'm noticing it the most. And I don't really work with a whole lot of teenagers and kids. I thought I did at one point, wanted to, because they're near and dear to my heart. But sometimes I have a hard enough time getting adults onto the program, one person. And now when you're working with teenagers, you have to have them and their two caretakers on the same program. And oh my God, it was maddening. So yeah, it is heartbreaking to see what's been happening in the world these last couple of years and how it's affecting everybody's mental health. Like it is heartbreaking.
Mm-hmm. And unfortunately, I think the traditional Western medicine, Western psychiatric paradigm doesn't have a whole lot of great solutions. I mean, unfortunately, if you go to the doctor, your primary care doctor, or even a psychiatrist, they're going to say, well, you're feeling depressed, you're feeling anxious, cut back on the caffeine and take this pill. Right. And for some people, that pill helps, but it can come with side effects, and it doesn't necessarily change the circumstances of someone's life. What I hear a lot of people who go on meds sometimes say is like, everything just felt more manageable, but it still didn't make me happy. And it didn't take away the issues that I was struggling with. So to me, the medications have their place, but are a bit like a Band-Aid rather than really getting at what is the root of what's creating the issue, the problem, the imbalance, whatever it is. And I think you and I both are really oriented toward discovering what is the root cause of this issue that someone is presenting with, whether it is anxiety or depression. I see a lot of people with trauma and PTSD. So for me, I'm always in the question of, where is this coming from, and what tools can we use to shift the energy around this root cause so that the person doesn't continue to suffer in present time, usually or often due to something that happened a really long time ago. And I think people don't quite understand that. There's a lot of people that'll say, well, you had some trauma, crappy things happen in your childhood, get over it. Right?
One of the worst, Dr. Phil. Oh, fuck Dr. Phil. Excuse my French. but my mom used to repeat a parrot, what he would used to say, you got to rise above your raising.
Right.
Oh my gosh, that is such a bunch of bullshit. I mean, it works for the people who did the damage to you while you were being raised.
Yeah.
But then once you get raised and all the trauma is still stuck in your nervous system, like you can't just rise above that.
That is correct.
It's work.
Yes. Yes. And I think the part that people don't understand, right? So a lot of people and traditional psychologists and therapists will focus a lot in therapy around talking about the problem, right? Talking about your trauma. Let's hear your trauma story. Like if you keep telling your story enough times, eventually it won't have the same effect on you. But that doesn't actually, systemic exposure therapy, like it has some efficacy, but not really a lot, because what it's not doing, just talking about it from this part of your brain, the prefrontal cortex, the very human, logical, thinking, reasoning part of your brain, isn't where the trauma is. The trauma itself is locked in your body. It's locked into the more primitive parts of your brain, your subcortical regions, what some people call your lizard brain, or your emotional brain, your limbic brain. The amygdala is a huge part of all of this, how the amygdala is involved in the fight, flight, freeze response. And so when you've had, early life experiences, and a lot of people don't even identify with trauma. They say, oh, well, I never got beaten up. I wasn't sexually assaulted.
I didn't associate with trauma either. I was kind of shocked
Yeah.
when I got into that class and I was like, oh shit. That was oh shit.
Day-to-day life here on this planet is traumatic, right? We talk about big T trauma, which is some of those more obvious things, but then the little T traumas, the trauma of losing a friend or a relationship or your pet, being the microaggressions that women or people of color might experience every day when they walk into a store, or when you're walking down the street and someone gives you that look.
Or even about this, the trauma of a life that humans were not meant to function at this pace.
Correct.
Pace of life, right?
The constant stimulation.
Exactly. That in itself is a micro trauma,
Absolutely. The constant bombardment of information through all the different devices and social media. It's just a nonstop morning, noon, and night onslaught, not to mention the trauma of the toxins that we're exposed to in the air, the water, the food. It's really like a nonstop barrage. And so what's happened for people, I think, is our nervous systems have gotten stuck in this on position. And for some people, it's the opposite. They've gotten shut down and more in the off position, or, people are kind of waffling between the two. But we're out of whack as a culture. Humanity itself is clearly out of whack right now. And the traditional paradigms alone don't seem to be enough to assist people in getting to that root cause. Like telling me about your problems, telling me about your trauma is a piece of it, but it's not the only piece, nor is the pill the only piece. It has to be this combined holistic approach that's really looking at, in my view, like something like anxiety, depression, addiction, from the physical, mental, emotional, and spiritual components. All of those have to be identified and addressed in order for the person to really be able to heal from whatever it is and have a life that they feel like is worth living.
Mic drop. Can I get a hallelujah? Man, doctor, you are on fire. That was beautiful.
Yeah. Well, I kind of am on fire these days. I'm at a stage in my career. I've been at this, over 25 years. And more and more, I think the reason that, I do these podcasts and I speak and I do more speaking engagements now, and I have my own podcast, is because I am trying to get this information out there, because I think the average public doesn't have it, doesn't understand what all is happening with mental health, doesn't understand that there are tools out there that we can use that actually come from other traditions, from Eastern traditions, for example, or not understanding where the science has taken us, even in the West, like understanding brain functioning better and being able to do lab work like you do, to get a better sense of what's going on inside somebody's body, how their body's metabolizing things and functioning. We have a way better technology to be able to identify those things and then remedies to change them, whether they come from the more traditional Eastern approaches like traditional Chinese medicine or traditional Indian medicine, Ayurvedic principles, whatever it is, or the more high-tech Western ways of doing things. I think we need a combination of all of that and to individualize it to each person's needs, because each person is different. No two people who have depression are going to look the same.
Oh, absolutely. Absolutely. And that one pill, when you go to the doctor and they pat you on the head and walk out, like that was so defeating for my early 20s. I must have been on 5 or 6, 10, different antipsychotics, antidepressants, mood stabilizers. And they would try this concoction, which would get rid of my sex drive. And they'd try that concoction, which made me gain 50 pounds. And they would try this concoction, which made me a zombie. It was just, or if they did find something that would work, it would only work for 6 months, 8 months, 9 months, because of the way our brains and our bodies are adaptive. And they would adapt to those damn drugs, right? And work around it. And then now we're back to the same square one again, because we never addressed the root cause. We never looked at the body as a whole. So how do you work with folks? Like, what is your specialty?
So I'm a licensed clinical psychologist here in the state of California. I specialize in treating addiction and trauma. I'm also the clinical director at a women's drug and alcohol rehab where we specialize in co-occurring mental health disorders and trauma along with addiction. And I'm also an empowerment coach. So I work with kind of different populations, but the tools that I use and the philosophy and the approach is the same, whoever I'm with and whatever I'm doing. So I guess I'm much more holistically oriented. Like I said, I'm looking at the physical, the mental, the emotional, and the spiritual. How are all those things connected to what the issue is? So if someone came in, let's say with, commonly you'll see depression, anxiety, right? They come in with that. I'm wondering, when was the last time you had a blood workup? Like, are you taking any kinds of vitamins or supplements? Our food is really depleted of nutrition. How are you eating? Yeah.
Our guts are leaky and not absorbing that nutrition.
Correct. Are you taking probiotics? Like, kind of getting a sense for what someone's care for their body is. Have you had illnesses before? Have you had, or is there a family history of that? I have my own history.
Feelings in your mouth.
Oh yeah. Right. I don't necessarily, like in my intake, ask all of those things, but in the course of getting to know someone, I definitely get to find out what's going on. I'm always wanting to know about their like basic sleeping, eating, movement, sort of the basic self-care body things. I am wanting to know that, but if I'm working with someone, let's say, who has been diagnosed with a chronic condition, if they are dealing with an autoimmune thing, I happen to have personal history with that. I grew up with a mother who had severe rheumatoid arthritis, fibromyalgia, IBS. So, I experienced a lot with her growing up. I had my own bout with Lyme disease, chronic fatigue syndrome, and everything that came with that. So went through that whole journey. And so I feel like, in comparison to a lot of other therapists, I'm a little bit more experienced and oriented toward these kinds of conditions from personal experience. And then, of course, I've worked over the years with hundreds of people, if not thousands of people, that have also had these different conditions, and I've learned from them. So clearly the body piece is key. And especially if I'm working with trauma, I'm definitely going to be oriented to where is the trauma in your body, right? I was a massage therapist at one point, and when I would do massage on people, sometimes you would touch a spot and the person would just
jump off the table.
Jump off the table. Yeah. Something very dramatic that they didn't even have a conscious awareness of. I work a lot with the subconscious, which to me includes the body, all the things that we're not aware of with this prefrontal cortex part of our brain. So that's the physical to me. The energy flows. How's the energy flowing in your body? Are there blockages? Some of the modalities I use from energy psychology are working with the acupuncture system. So the meridians, the different, energetic pathways. Some other modalities are working with the chakras. So the energy centers of our body and how the energy is flowing or not flowing, where it might be stuck. Emotions can get stuck along those pathways. I'm looking at that mentally when I'm doing the mind work. It's a lot of the standard stuff. I'm looking at your core beliefs, how you came to see yourself, your self-image, your beliefs about yourself, your beliefs about the world, the filters through which you're hearing things and seeing things. A lot of us have distorted filters. That's a big part of it. But instead of just helping people to identify what are your core false beliefs, as I like to call them, or what are your thought distortions, where are they coming from and how can we actually change them? So using tools that allow us to shift the energies around those beliefs, like I'm not enough, I don't deserve to be happy, good things are for other people, not me, the world is a terrible place. Yeah, all that stuff. I work a lot with that. The emotions to me come out of all the mental. Whatever you're believing to be true is going to inform what emotions you are experiencing. And then we experience those emotions in our body. So to me, the emotions are another entry point, but they're always connected to the body and the mind. And then the spiritual, which I think is the piece that's often overlooked. A lot of people, equate spirituality with religion. That's not what I mean. It might include a religion, but it may not. Spirituality is really much more about your sense of connection to yourself, like it starts there, like your connection to your true authentic self, versus a lot of us are wearing a mask, pretending, to the outside world, especially these days through our Instagram and social media, we're putting on this like airbrushed, filtered, right. Look at me. It's not the real me. And when we are not connected with our true authentic selves, there's a whole bunch of things that start to happen that affect us psychologically because we're not actually honoring ourselves and being connected with ourselves. So we don't feel whole, we don't feel complete. Because I'm coming from a perspective that we're actually born whole and perfect. And we learn how not to be, right? Like those core false beliefs actually start to disconnect us from our true essence. Absolutely. And so we're walking around thinking we're broken, we're defective, there's something wrong with me. And that belief, your point of view is what creates your reality. If you believe yourself to be those things, that's what you're going to create, is a life that's full of problems and traumas and dramas that are going to prove to you, see, that's because I'm not a good person. I don't deserve these good things. I deserve this bad stuff to happen to me. So working with that piece and helping people have a sense of deeper connection with themselves, of living more authentically rather than pleasing, especially as women, a lot of us tend to live for everyone else and not for ourselves. Working with people around like, who are you really? What's true for you? What do you want to be creating in your life? And what's getting in the way of that?
Absolutely. Wow. That was a lot. I love though the way, you brought it down so simply. Like I've never heard anybody explain it that way, that when you're in talk therapy, how you're stimulating the front part of the brain, but the trauma and the other stuff is stuck in the back part of your brain and in your body. Like it's a no wonder that there's a disconnect there then, and why talk therapy has a tendency to reactivate, re-trigger folks instead of actually getting to the root cause. Because talking about it is again, not getting to the root cause. That's, you might take some of that edge off, right. From when it originally happened, but it's not getting to the root cause. So that was beautiful. Thank you. So how long do you typically work with people, and like, what does a typical session kind of look like with you?
It could look like anything. There's so much variety in that. It really varies. I certainly have people who are coming to me with a very specific issue that they want to address, and that's kind of all they're looking for. I have other people who maybe come in with one issue and realize, wow, that was a really cool change, to be able to shift that. And now I have all these other things I want to work on. And I have long-term clients that I've been seeing for years. Mm-hmm. So it's a mix. And some people I see once a week or twice a week. And some people I see every other week. And some people I see once a month. And some people come as needed because something's come up in their lives. Mm-hmm. So I don't have a prescribed way. It is very individualized. I think any kind of work we're doing, healing work, has to be individualized. It's about, what is this client coming to me with, not what modalities and philosophies can I impose on them to make them, which is what the Western model does. That's what the DSM does. As psychologists and therapists, we work with the Diagnostic and Statistical Manual of Mental Disorders, which is basically about, does your person fit into this category based on these symptoms?
Right. Here's your box. Can you put them in?
Correct. Can you put multi-dimensional people into a two-dimensional flat box.
It was fascinating. Me and my husband were talking on a walk today, because today in Colorado was like the first day that actually feels like spring. Like the sun felt glorious on my skin, and it felt like for the first time we're coming out of winter. But we were talking about how he's been working with Bruce Lipton, and how they talk about how like that first 7 years, right, are very, very impressionable. And I was sharing something with him that I was at a networking group earlier today, and there was quite a few 250, 300-pound people in the health field, and how I had a really hard time with that, right? And why can't I show more compassion? Why can't I show more understanding? And then it dawned on me that that's not a part of my blueprint. I didn't get compassion and understanding growing up as a kid. I got judgment, I got criticism, I got bullied, so it's funny to try and come at somebody with something, with the tools that you don't have. So that's why I love that you work with people in that deeper, connection, spiritual worth, like building somebody up, because you can say all those damn mantras and fake it till you make it. But again, sure, that's not going to get you all the way either. I mean, I did that for years, and here I still am going, why am I judging these poor people,
Right. Well, compassion goes a long way. And I think it speaks to also us doing our own work, right? Like if you're going to be in the healing arts, you got to be doing your own work and recognizing, being willing to recognize where you might have your own block around something. I mean, there's this sort of thing we joke about as therapists, like whatever you need to work on, you're going to end up having clients that come into your practice that are working on that exact same thing.
There's a mirror. I remember when I moved to a spiritual intentional community a couple of years ago, and it was the most intense experience I've ever had in my life, because like all these like-minded people were also my mirrors, and everybody was kind of in deep working on the same. Oh my God. It was a huge blessing, and 2 years was all I could do before I had to get out. But I've heard therapists say the same thing, that in an office full of therapists, that a lot of times there's a lot of squabbling and issues, within the office because of that same thing, that they're kind of, attracting like people.
It's happening. Well, it's happening in every environment. It's people are reenacting their family of origin dynamics in like a corporate workplace.
Right.
Except in a corporate workplace, sometimes people are not quite that conscious and not necessarily willing to look at their stuff. Me working in a rehab, where everybody's been through stuff, it becomes a very fertile ground for us to confront and face our own stuff, because we get activated. We get activated by the clients, we get activated by each other. And it's just, the demand is like, if you want to avoid as a healer, like vicarious traumatization or burnout or compassion fatigue, which are all very real things. And a lot of them are happening right now in this pandemic, because we've all been so overworked and overextended. All that stuff will come out. All the shit will come out, Heather. And it'll come out in this way that if you're not willing to work on it, it's going to create problems for you. My experience has been, if we do not address the underlying root causes of whatever our distress is, it just festers and gets more toxic and has a more and more toxic effect on your life. I mean, we know this, right? Trauma untreated progresses. A disease condition like cancer untreated progresses. So it's really incumbent, I think, on us to keep doing our work. So the same tools that I use with my clients, I use on myself. There can be hands-on. You'd asked about what a session might look like. It might be, me and the client sitting down if we're actually in the office, so these days it's been kind of a mix of online virtual stuff or phone stuff. And a handful of people I still see at the office. It's, changing now, but it might be sitting and talking and getting a sense for what's the issue, what's going on. But there's always going to be an application of tools. If we're talking, then I teach clients tools to get to the root of the belief or emotion or whatever it is, so we can clear the energy around that stuck energy, like whatever's associated with it. This is a belief you picked up in childhood. This is a piece of unresolved trauma. So we might be talking, but we're using tools. We might be tapping, right? We might be stimulating acupuncture points while talking about an emotional distress, because what it's doing is that tapping is sending a signal up to the brain, to the amygdala, to the more primitive parts of the brain, saying, hey, it's okay, we're safe. Even though this is an upsetting situation, it's not a life or death situation. We don't need to be acting like a tiger's coming after us. Right now, we need to calm the nervous system down. We need to let the body know that it's safe, and we can still address this problem without the freak out or the shutdown. So It might look like that. I have a massage table at my office that's up all the time. It might be hands-on energy work. I do a lot with access consciousness bars, other types of energy work. We might be doing that, and there may be talking with it, there may not be. I might be doing some muscle testing, what a lot of chiropractors or naturopaths will do in their practice, because oftentimes, again, we can't access the information, the root cause of something, an emotion that's blocked. We can't necessarily access it just through our conscious mind. We might need to do some muscle testing to get the information from the body. The body will tell us, right, what's going on. So it looks different in different situations, for sure.
That's awesome. Could you go into a little demo and explanation, because you brought in tapping, and actually I haven't had anybody on that talked about tapping yet. I love tapping. I think it's a great freaking tool. It's one that I'm always quick to use with others, and I always forget to use it in my own when I'm in the middle of something, and it's like, oh, and then afterwards I'm like, oh, I should have tapped on it. But would you mind demonstrating?
Sure. Yeah. Let me give a little explanation first. So tapping is Meridian-based tapping. It has a lot of different forms it comes in. The original version was called thought field therapy, developed by Roger Callahan back in about 1980. He was a psychologist who was looking for ways to help his clients that had phobias, PTSD, and all of that, and the traditional methods weren't working. So he started studying acupuncture. And one day he was working with a lady that had a water phobia, lifelong water phobia. And all the traditional exposure therapy and whatever wasn't really doing much in the talk therapy realm. But she came in one day with a stomach ache. And he's like, oh, I've been studying acupuncture. I know that if we stimulate certain points, we can help your stomach ache. And he didn't use needles. Instead of stimulating those points with the needles, he used tapping, which is also common in Chinese medicine. And he found not only did her stomach ache go away, so did her lifelong phobia of water. So being very curious about this, he started bringing in these principles into his psychotherapy practice, and thought field therapy was born. From there, people took it and adapted it. They changed this, they tweaked that. He originally did not have you talking while you were doing the tapping. He just had you be in the thought field of the distress. So think about that traumatic event. Think about that phobia. Notice how you feel it in your body. And he had you just kind of be present with it as you would tap through the points. And we can still do tapping that way. It still exists live and well. But at some point along the way, one of Callahan's students, Gary Craig, decided he wanted to simplify the protocol. And he developed EFT, emotional freedom techniques, which is really the most common version you tend to see out there in the mainstream. There are these lovely folks at the Tapping Solution. They put on a summit every year. It just wrapped up recently. They have an app, a free app called the Tapping Solution for your phone. They have books and programs. They're a great resource. Another great resources, Dawson Church, EFTuniverse.com. He does trainings with professionals. He has a free manual you can download. There's a lot of resources there as well as like quick access to a therapist for even like short 10, 30-minute sessions to deal with just like, what you're saying, like I'm freaking out right now and I just need to get through this. That's a cool resource. But basically what we want to do when we're activating these acupuncture points by tapping on them, what we know is that now from the Western science, the original Chinese medicine would say what we're doing is we're removing blockages or imbalances in the flow of qi or energy along these different meridian pathways. These meridians are like blood vessels, they run all through your body and energy passes through them. And this has been documented, science, and we have technology, we've got MRIs, we've got machinery that has basically validated the existence of these energy fields in the body. Harvard Med School did a 10-year study on this. It's not woo-woo like we used to think. There's like actually real things happening with these energy flows in the body. But the other thing that science has now told us is that when we stimulate that point, we're sending a signal up to the amygdala, that part of the brain that's responsible for that fight, flight, or freeze response. And we are sending a deactivating signal, getting it to basically calm the nervous system down. So we can use that in the moment when we're feeling stressed about something, which is what I'll demo. And we can also use it to get to the deeper stuff like trauma. We can process deep trauma through this process. We can, for example, someone's been in a car accident. We could tap on all the different aspects of the car accident. We can even do it like a movie, like, okay, this happened, and then pause the scene. Like, what do you notice coming up? Tap, tap, tap. Okay, let's go to the next scene. Now there's been an impact. Now, what are you thinking? What are you feeling? What are you remembering? Tap, tap, tap. And so what we do with that is we take all that emotional charge, all that traumatic energy that got locked into the body for the person, and we're releasing it, right? We're telling the body, hey, this trauma isn't happening anymore. We're safe now, and we don't need to have that reactivation of that fear, panic, whatever it was that we experienced at the time of the incident. And so this fascinating thing called memory reconsolidation happens, where after you've done the tapping on the traumatic event, you can look back on it and you can tell the story of it like totally calm. You don't get that activation anymore. You don't get that distress, that panic, like driving past where the accident happened and, your whole body goes like this. Right. All of that gets gone. We extinguish the conditioned response of the trauma. So this really helps us to rewire the brain. You can see how that might work over time. But the way I typically teach it to the clients for them to use on themselves is to do something like this. Like, think of a stressful situation, not your deepest, darkest trauma, something that's just creating some moderate level of stress for you. And you can do this too.
I had a guy riding my ass this morning, and then he was flipping me off, and nerves were fried afterwards.
Yeah. So just notice, so you remember the experience, and it could be something that happened or something maybe you're worried about that's coming or might happen. And then you get a sense for, okay, where do I notice that in my body? So like when you think about it, that experience, where do you notice it?
In my chest.
Yeah. So there's some sensation in the chest, right? And there might also be some thoughts about the experience.
Oh, absolutely. He scared the crap out of me. I thought, when you've got a big truck like that riding your butt at 65, 75 miles an hour, it's terrifying.
Yeah. So there was fear, there was terror. There may have been thoughts like, oh my God, he's going to hit me. I'm going to be in an accident. I'm going to die. Any kind of thoughts like that may have been there too, right?
Absolutely.
Yeah. And then we always want to rate the intensity of whatever that upset is on a scale of 0 to 10, where 10 is the most intense and 0 is no distress. So and it's for right now, not when it happened, but right now, when you think about that experience, how intense is it for you?
It was fascinating because I noticed that I wasn't having an issue with it. And then we started talking about it, and now it's back up to about a 6.
Yeah. So see, this is what I'm saying. Just
right?
Because the event has passed doesn't mean the trauma of it isn't still with you.
Absolutely.
Right? Okay. So what we're going to do is I'm going to give you just really simple EFT with no words. Okay. Just thinking about that upset. And we're going to tap through a series of points. Okay. So we're going to start with the side of the hand. Doesn't matter which one. We call this the karate chop point, and this pinky side here, lightly tapping. And let's bring in the breath, because the breath also helps to calm our nervous system down. So we're just going to take a nice deep breath at each point. Okay. And then we go to the inside of the eyebrow. So this is kind of where the eyebrow, the edge of the hairs there meet toward the bridge of the nose. And you can do one hand, you can do 2 hands, doesn't matter. And then we do another nice deep breath. And then we go to the side of the eye. So right over here at the edge, kind of right where the pointy part ends, not too far out, just right in here. There's a little groove in the bone there. And we breathe. And then we go under the eye. So under the middle part of the eye, right there on the bone, under the pupil. Remembering that experience, driving in your car. Mm-hmm. And then under the nose, right between the nose and the lip, how scary that was, how terrifying that was for you. Okay. Your body still remembers that. And then we go on the chin, right under the lip in that little cleft part. And we're just tapping on all the like upsetting parts of it, right? That fear, the terror, here we go to the collarbone, the tightness in the chest. So the collarbone is like not right on it, but actually below, about an inch below, in that space between it and the rib below it. Okay, it's a little bit out from the sternal notch. Breathing, letting the body know that, yes, that was really scary, but it's not still happening now. Under the arm, we go down from the armpit about 3 or 4 inches. It's like kind of in line with the nipple, about at that height. Letting go of that trauma, letting go of that fear, letting the body know that it's safe. And the top of the head. Okay, that's one round. Okay. And then we might want to do another round, and if I've done one hand, then I might switch it up and I might use the other hand. Okay. And then we're going to keep tapping until that stress level comes down. And you really do have to tap on the negative stuff first to allow your body to release it. And then you can also move into more positive or affirming statements once the stress level comes down. Usually it has to come down below a 5. And then you can say, okay, so, like, even though this happened, I'm safe now. It's okay to relax. Body can be calm, and you can put more affirmations in there. But generally, we want to focus on releasing all of the stressors first. So after we just did one round, but after doing that, what do you notice?
Went from a 6 to a 4.
Yeah, exactly. How cool, right? And for my clients who have addiction issues, that small jump from a 6 to a 4 might just be enough to get them to not go out and have a drink or a hit or whatever their smoke or whatever their drug of choice is, to cope with it, right? So what we're giving people is coping strategies they can use to regulate their own nervous system, to calm their emotions, to allow for more peace and ease, and so that this part of their brain can stay online or get back online, and they can reason their way through it, right? Oh, I could call someone for support. I could challenge my belief here. I could use some other tool I've learned that I don't seem to have access to when I'm in that full blown kind of panic, fight, flight, freeze response. That's what I really try to teach people, is you first got to get out of that response. And you need a nervous system calming tool to do that. Tapping is great. Certain breathing techniques are great. Holding ice cubes in your hand or like putting cold water on your face can help. Anything that activates the vagus nerve, which runs through our whole body, that activates it to get out of sympathetic nervous system arousal and into parasympathetic calm and relaxation. It's a sense of safety versus the sense of threat that we're all wired with as animals. It's part of our survival. Yeah.
Man, this has been so truly amazing. And I'm so blessed that you said yes and came on today. Tell me, do you have any specials or workshops or anything coming up that you kind of want to plug and promote, or, how do people get a hold of you?
Yeah. Easiest thing is probably my website, adrianapopescu.org. And from there, you can find out and I'm on all the social media platforms. You can find all the links to everything there. I have a podcast of my own that you have been a guest on called Kaleidoscope of Possibilities, Alternative Perspectives on Mental Health. I also do a free Facebook Live every other week called Ask Dr. Adriana. And I just talk about different topics, take people's questions. I do offer workshops. I've got a couple of Access Consciousness workshops coming up in April. You can find those on my website. So there's a lot of resources. There's a lot of information. Definitely pretty active, particularly on Facebook and Instagram. YouTube, my YouTube channel has a ton of stuff. So people can find me all over, and certainly are welcome to reach out with any questions they may have, or if they're looking for some suggestions around how they might approach a certain issue. I'm happy to offer whatever I can to contribute to that.
That's awesome. Thank you so much. Again, I'm very blessed, and I'm so looking forward to getting this episode out and getting it out to the folks, because you've shared so many amazing tidbits and wisdoms and hope, right? And that's really what this is all about, is we're out here to try to inspire hope.
Yeah, I mean, you and I both have struggled, with illnesses and conditions that, Western medicine told us were incurable, and it's simply not true, right? The thing is, everything, your thoughts, your emotions, your physical stuff, it's all energy. Energy is malleable. We can change it. So there is hope for anyone and everyone if they really want to change something.
Absolutely. Can I get an amen?
Amen, sister.
Awesome. Well, you folks stay tuned, and thank you again.